Welcome back to Let's Chat. We're spending some time with our friends from the Hamilton County Health Department. And today we have Jenny Lawson on board with the Tennessee Breast and Cervical Screening Program, learning all about that and really the importance of it specifically during Cervical Cancer Awareness Month. We're kicking off the month of January, a very busy year ahead, and this might be something that kind of flies under people's radar. Thank you for making the time to be here, Jenny.
Thanks for having me.
So for people who don't know about Cervical Cancer Awareness Month, they don't know the importance of it, why are you guys wanting to stress that and really provide emphasis for us this month?
Yeah, so cervical cancer is highly preventable and highly treatable as long as you get screened often, and there is a vaccine that you can get to prevent it. And so it's one of those that there's many gynecological cancers, but cervical cancer in particular is just so easily prevented.
Absolutely.
And so we want to let people know that you know, there are ways to get screened and prevent that are accessible in our county.
Absolutely. And you guys do so much more besides that. You're always keeping people informed with the Hamilton County Health Department, and you guys are amazing at that. For cervical cancer-wise, when we think about cancers that really impact women, a lot of people are going to think breast cancer. That's probably the biggest cancer that people think of. Cervical cancer kind of sometimes goes underlooked. Why do you think that it's important to really raise emphasis on that, and why it's such a scary thing?
Sure. Well, I think because it's a gynecological cancer, and a lot of people just don't talk about it.
They don't.
And then getting a pelvic exam can be uncomfortable. There's a lot of barriers. People can be afraid that they can't afford to get screened. I think as women sometimes that we take care of everyone else before we take care of ourselves. You just get busy and you just don't think about it. So we do have a program called Tennessee Breast and Cervical Screening Program that we have at all of our health departments, and I'm the coordinator for this county, and so we can provide services for breast and cervical cancer screening for women who are Tennessee residents that are low income and have no insurance, and we can provide them with services for free or very low cost.
How amazing is this? You're really removing all the financial barriers anyone would even think of, and you're giving them this resource that they can go and just take advantage of for something that can impact all of us. Is there like an age range? This is going to probably sound like a stupid question, but is this an age range when it comes to cervical cancer, or who's the target kind of demographic for this?
So screening begins at age 21.
Okay.
And then usually 64 is when they stop screening. So, and it varies on your risk factors and how old you are. You know, it's not, you don't get screened every single year anymore. It could be 3 years, it could be 5 years. Depending on if you've had an abnormal result, you may get screened every year. So the best answer is just talk to your provider, and they will be able to work out how often you should get screened.
And I think that makes such a big difference, because just knowing about it and saying it, getting the professional opinion, I think goes such an extra mile, because you could be as young as, like you said, 21 years old, and then all the way into older in life, and then get diagnosed and not even realize that this is something that you have. So I think that's so important to be able to screen. Tell me about when it comes to routine screenings like Pap smears, Pap tests, and HPV tests, preventing cervical cancer before it even starts. What does that look like?
Okay, so almost 90% of cervical cancer is correlated with the HPV virus. And so now when you get a pelvic exam and Pap, you get tested for HPV also. So, and depending on how old you are, how many abnormal tests you've had, then you can do diagnostic testing, which we also will pay for. So you could need just a closer look, you could need a biopsy, and then based on those results, you know, that's why it is so important to get screened, because they can literally prevent it from happening before it happens. So if you have abnormal cells, they can go in and just remove those abnormal cells until they get clean margins, and then it will never grow into cancer.
How amazing is that? And something that can be so easily preventable, but just by coming and talking to you guys and getting an opinion from the professionals. Remind me again how we can get in touch with you guys from the Hamilton County Health Department.
Sure. So my phone number is 209-8009, and I would be happy to connect you with the closest clinic. You know, there's other clinics that use our program Two, we can, go over the options, and we have fantastic nurse practitioners at the health department that are so kind, and they take their time, and they do a lot of education, and they just really have such a heart for our community.
You really guys are taking care of people in the community, and I think that's so special. To learn more about them, you can go visit those links on the screen, but we also want to bring today's megaphone poll question of the day, sponsored by 1% Less Scenic City, and this question is just going to be something sort of evergreen during the flu season. Have you gotten your flu shot yet? Yes or no? Answer it. It's short, simple, and easy. You can also use that QR code there on the screen to learn more, and you can visit the Hamilton County Health Department to stay informed and stay up to date about all things health related and to keep you going during this flu season guidance as well. Stay with us. You're watching